All right, so go ahead and introduce yourself for me.
Okay, my name is Jean. I'm 78 years old. I live not far from here on the South Hill of Puyallup.
Okay, so you've been a patient with Dr. Lipinski for quite a few years.
For 12 years.
12 years, that's so wonderful. So what first brought you to Dr. Lipinski and how did you find out about him?
Okay, I think I had felt like I was out of alignment for some time, and then I needed a total hip replacement, and so I always thought one hip was higher than the other because I would make my own clothes, and when you make them, the hems were always, at least an inch difference when I was finishing off. And so after my hip replacement, I thought that would be okay. And when I went back to the surgeon for the after, see how I was doing, he said, no, you're perfectly aligned in your hips, but my neck was hurting all the time.
Interesting.
And so I mentioned it I walk with some ladies, so of course we all discuss everything.
Yes.
And one of the ladies, her son went to school with, I call him Dr. Craig in my mind, went to school with Dr. Craig, and she had come here, and so I thought, well, I'll give him a try and see. To me, chiropractors were just chiropractors, and I didn't know anything about NUCCA at that point. And so he explained to me that yes, I was out of alignment, and that's why my neck was bothering me. And we went through the series of visits that you need to do and got onto a schedule, and then I was feeling fine, so of course I quit coming. And then for whatever reason I started to hurt again, and so I came back, and for many years, and I was doing pretty good. Sometimes he'd have to adjust me. I like to garden, so maybe I was picking up a heavy rock or something like that. This went on for probably so 2 years ago maybe it was. I had to have the other hip done, so that was taking thoughts away from coming here. And then immediately after that, my husband had to have back surgery, plus he'd been diagnosed with cancer, plus we had some deaths in the family. So for all those, I'm giving those as my excuses. I totally forgot that I needed to call up Lori and come in and make an appointment, until I started to feel the neck was bothering me again. Not a big pain, but it didn't go away, and I was conscious of it.
Yes.
And so I've come back, and I know you don't quit.
Yes.
I'm a lifetime patient.
You mentioned something earlier before we were recording, that it wasn't necessarily the pain that brought you in, but the pain was, you were wondering what had caused the pain.
Yeah, I mean, here I'd had my hip done, and wasn't that meant to make me perfect again? And it didn't. And so why did I have this pain?
Yes.
And I can't remember if I went to my GP, and of course all they do is give you medicine. And so then I thought, chiropractor. I didn't know any chiropractors. I didn't know who to go to. So that's why I came here, just because it was on a friend's recommendation.
Yes. Well, we're so glad that you've come, and so glad that you're seeing health and wellness out of this. And
I'd like to just add,
yes,
because I feel more healthy that way. I also have changed my diet. I've always struggled with weight, and although I'm still overweight, I believe in the whole food diet.
Yes.
That if you do away with those lovely cookies and apple pies.
Yes.
That goes along with it, and that makes you feel good too.
Isn't that wonderful? Well, thank you so much for your story.
Welcome.
Appreciate you sharing today.
Oh, it's good.